Starting this week, the Mission Act is changing the way the VA works with outside doctors. VA San Diego Director Robert Smith says some services are brand new.
Under the Mission Act, there is an urgent care benefit where veterans can seek care at an urgent care center, a contracted urgent care center, with no pre-authorization, no referral. They can simply drop by and get care for, a bee sting.
Or bronchitis or stomach flu, just go right to urgent care. Veterans still have to be enrolled in VA care to qualify. The Mission Act is a follow-up on the Choice Act. VA Secretary Robert Wilkie says Congress quickly passed Choice in 2014 in the wake of the wait time scandal, where veterans languished for months on long waiting lists at Phoenix and other VAs around the country.
Veterans Choice was a very hasty response to the problem in Phoenix. This department was given 90 days to change its direction, change its ethos, and that was absolutely impossible to do.
There were problems with billing and lost referrals. Some doctors dropped out. This time, Congress gave the VA a year to work out the details of the Mission Act. Choice also relied heavily on being managed by private contractors. The VA is taking back some of that control. Tasha Jones is a former Army medic who works as a section chief in customer service.
It is a lot of work, it is, but as long as we have the resources and the staff that we need, I'm confident that the VA can do the things like customer service and care coordination better. I'm actually excited that it's coming back.
VA San Diego hired 60 new people to manage the program, many of them schedulers like Jones, who arrange appointments and answer billing questions. The VA is also deploying new software to make it easier for doctors to share patient records with the VA. VA says the program roughly doubles the number of veterans who can go outside the VA. For primary care or mental health, veterans only have to show their wait time was longer than 20 days, or they live more than a half an hour drive from the VA facility.
Those are a small number of veterans, though, so about 95% of the veterans who are under our care would still have the bulk of their care or their coordination of care provided by the VA.
Smith says the VA is banking on most people sticking with VA care. Even with a year to prepare, it's all coming down to the wire. I interviewed the head of VA San Diego Monday. Some of the details about which providers would be part of the new urgent care benefit still hadn't been nailed down.
There's been a lot of contracting that's been going on in the background and kind of filling in the gaps, and I actually have not yet seen it. I have a promise of an email later today. I've not seen the complete list for the San Diego community.
Okay, and so
But it will be there June 6th.
Veterans groups lobbied heavily to replace Choice with a system more responsive to vets. Like the VA itself, the VFW, and other groups are waiting to see what happens after the new program goes live on Thursday. Steve Walsh, KPBS News.